our skin tends to produce more amount of melanin. Anything from a bruise to a burn to a pimple, eczema, or even a cut or any trauma on the skin ends up with a dark patch. Now, we Indians, we tend to, face issues with hyperpigmentation more often than our Western counterparts. We tan and pigment more, and they wrinkle and age even faster. Hi, I'm Dr. Natasha, a board-certified dermatologist, and today we're going to deep dive into the world of pigmentation, what are the triggers, what's causing them, and how to deal and manage with it. Now, hyperpigmentation in simple terms means a patch of skin that's darker than the rest and thus leads to an uneven skin tone. Understanding the root cause and trigger of it is what helps in treating it. Now, pigmentation is variable. There are various things that impact it, right from your genetics to where you're staying, your UV exposure, to your metabolism and what kind of medications and drugs you're taking also affects it. So, when we go to treat hyperpigmentation, addressing the root cause and the trigger is of utmost importance. Well, here are a few triggers and what we see on the skin. Exposure to UV rays will cause increased tanning, sunspots, freckles, lentigines, and even melasma. Metabolic changes in the body like diabetes, thyroidism, or even being overweight can lead to darker skin folds and acanthosis nigricans. Hormonal changes in the body triggers melasma or jaya and even acanthosis nigricans. Various genetical issues also cause hyperpigmentation. Various medications like BP medications, oral hormone contraceptive pills, and various neurological or psychiatric medications also triggers pigmentation. Even constant heat, from like heating pads or even laptops on your lap can lead to something which is known as erythema albignae. Various vitamin deficiencies like B12 deficiencies also lead to darker patches of skin, present all over our body. Metabolic fluctuations during pregnancy and puberty can also trigger pigmentary issues. So now knowing that there are various causes of pigmentation, listening to your favorite Instagram influencer online or your neighborhood auntie or your parlor auntie is not going to help in treating it. Please do go see a dermatologist to identify the cause or the trigger and understand on how to manage it better. Now, with pigmentation or hyperpigmentation management, the common term that one cream or one size fits all is not true. It really depends on the depth of the pigmentation. Now, if the pigmentation is just limited to the top layers of the skin, which is known as the epidermis, then it's easier to treat with lotions and creams. However, if it goes deeper to the dermal layer, then various in-clinic treatments are also required to help reduce it. Now, understanding that a holistic approach is needed to treat your pigmentation issues is key. A well-balanced diet, working out or exercising every day, balancing your metabolism, protecting yourself from the sun and UV radiation, and a consistent skincare is key. Various in-clinic treatments also help in reducing it. Still, the most important product in your skincare journey and in your hyperpigmentation journey is your sunscreen. It's protecting you not only from the sun rays but also the various UV rays that are present indoors that at the end worsens your pigmentation. Now understand that hyperpigmentation treatment takes time. You need to be patient and consistent and you will see changes.